Sue Jankowski, and this is Living Well on PHTV4. On Living Well, we look at nutrition and exercise and other topics that contribute to a healthy lifestyle. Today, we're talking to Michelle Beard, who is a registered nurse and co-owner of New B&U Med Spa that offers several services, including Botox, skincare, Morpheus 8, laser hair removal, and IV vitamin therapy. And now today we're going to talk about IV vitamin therapy. It's going to be a really interesting topic. Michelle, thanks so much for coming in to talk to us today.
Thank you for having me.
You know, we'd just like to know a lot about our guest, and you have a background as a nurse, registered nurse, and also now a business owner.
Yes.
Why don't you tell us a little bit about your background?
Okay, so I am a registered nurse. I've been a nurse for well over 20 years. I don't want to date myself too much. And I've worked in numerous areas within the healthcare, spanning from inpatient ICU nurse, also dialysis. I've also worked in the pharmaceutical industry, as well as education, nursing education and management.
Okay, a broad field of experience
Yes.
that you have. And now you're a business owner. How did that happen? And tell us a little bit about the business.
I have to say it probably happened more along the lines with COVID, and I've always wanted to kind of take my direction more into business as opposed to more into business. So I decided at that time I wanted to do aesthetics, nursing aesthetics, injector, and include in that IV therapy. So that's kind of where I landed.
Okay. Well, it's really an exciting field. You've got a lot of experience to bring to that. So I'm sure that's really an exciting transition to being a business owner.
Yes, and I do have a MBA, so a master's in business also.
Okay, so that kind of all goes hand in hand.
Yes.
Cool. All right. Now, I think maybe a lot of us don't really know what IV vitamin therapy is, and so I think it's really interesting to find out about it. So I guess the first question is, what is IV vitamin therapy?
So IV vitamin therapy is where you inject the vitamins. You kind of have a mixture of nutrients, vitamins, and you put those directly into an IV into the vein, and it goes directly absorbs into the patient's bloodstream.
Okay, so it's really what it sounds like. You're getting an IV, there's vitamins in it.
Yes.
Okay, I guess a lot of us take vitamins. What would be the difference between getting IV vitamin therapy and just at home taking your vitamins?
So when you think about IV vitamins, they go directly into the bloodstream, so they're 100% absorbed. So for people who have digestive issues, you're not going through the gut. And with, so it's gonna be absorbed much better for those people. When you're taking oral vitamins, those are actually, it goes through the gut, so your absorption rate is going to be about a 20 to 30% absorption rate. So you're losing a lot of those nutrients because it has to travel and go through the GI system.
Okay, so I'm thinking that, first of all, why would you switch from one to another? Is this mainly for people who have like some kind of health reason to do it, some sort of health deficiency where they're going through some maybe cancer treatments, or I don't know who gets this. Why do they do it besides easy absorption?
So it's actually available to anyone. So if you find that maybe someone who's pregnant and they're throwing up a lot, they can get vitamin IVs. If you have someone who is an athlete, they're working out all the time, they're losing those nutrients. So anyone can really take the vitamin IV. I would just say make sure that you're talking to a professional who can help to direct you in the best therapy for you.
Okay, so is it like what kind of vitamins are in there? Is it like the same as for everyone? I mean, because we all really kind of need a lot of vitamins, so
Yes.
we usually get them out of our foods that we eat. So am I deficient in zinc or magnesium or B12 or C? I mean, how do we know this?
So we will have a consultation, and we talk about different things that you may be feeling like. Maybe you're lacking energy, or you're sick and you need vitamins for that. So there's a multitude of vitamins that can be tailored to what your needs are. So we do a kind of a brief health history to see what your concerns are, and then we kind of take it from there, and we will make that vitamin based on what your needs are.
Okay, so you do just a history with the person, and they would have like a specific need. And I understand if you have like digestion issues and you can't take vitamins, that would be a reason perhaps that people come to you to find help.
Yes, we've also had patients who have that have cancer, and there's not really any antidote, but with that vitamin C, they do feel a lot better taking it. So there's really nothing antidotal that says that it's going to work for them, but they do feel the benefit of it. Also, again, if you are working out a lot, you're depleting yourself of those electrolytes, we can put them back into the body. So there are a lot of reasons why people would get an IV hydration.
Okay.
And our bodies don't always, we utilize it, and as you said, we get it from food. However, again, that's not 100%. As we get older, we're going to lose some of those nutrients. So we want to make sure that we're replenishing our bodies with that. An IV is going to be a faster, quicker absorption as opposed to taking it orally. Now, orally, you can enhance it with an oral, but the recommendation would be based on what's going on with you specifically, but also the fact that we can tailor it to your needs based on the rate of how often you need it, how much you need, and what is actually going on with you physically.
Okay. Is this something that would be like you should see your physician, go to your doctor, see if this is something that would be beneficial to you? Is this like the procedure that someone would go through?
It actually would be beneficial to anyone. Again, based on what your needs are, we all are going to lose or not get as much absorption as we get older. However, there is a physician in the office that I work in. She is an internal medicine physician, so she's there all the time along with a nurse practitioner. So we do in the office, not only are we given IV hydration, but we do have a physician there that is an internal medicine physician that can, if there is a need to see a doctor, we have one readily available.
Okay, so you got all your medical bases covered there.
Yes.
Well, that's very good. What kind of side effects could people expect? I always think about all these ads on TV for all kinds of things, and there's a million side effects. And so there's got to be probably something that would be a side effect with this.
Typically, it's going to be infiltration when you stick the needle in there, or you can also get an infection potentially an infection from insertion of the needle. You can get an air embolism, so you want to make sure that you're working with someone who is knowledgeable. But that's basically those are your
Possible issues that could come up.
Yes.
What is the feeling in the medical community about something like this? Do nutritionists, dietitians, doctors, do they have like an opinion about the benefits or the non-value of it?
I think that there is a array of opinions about it. Most people do feel like vitamin IV is good to replenish our bodies, but also there's that incorporation of your oral vitamins also, because there is a cost to it. So based on that cost, everyone cannot afford to have the IV hydration on a regular basis. So you will incorporate that, but there is definitely a benefit across. If you're looking at each individual practitioner, they can tell you that there is a benefit of IV hydration.
Okay, so this is something not covered by insurance.
Correct.
and so it would be an out-of-pocket cost. What can people expect to pay for something like this?
There is a wide range. So a basic IV would be right about $125. It can go up to $700, $800. So it just depends on what the need is. Some people can use their FSA or HSA to cover it. So that is something that can be used.
And is this something that once you start, you keep going, or it gets you over the hump, or is it all kinds of situations?
There's all kinds of situations. So based on if I'm going in for surgery, I may get an IV that helps me with my recovery. After my surgery, I may get an IV to help with that recovery also. Say I went on a flight and I have jet lag, I can get an IV for that. If I'm an athlete and I'm out and I've just depleted my stores of nutrition, I can come in and I can get an IV for that, or should I say my electrolytes are imbalanced, I can get an IV for that. So there's a wide variety of IVs, or reasons why people would take them. The frequency would be based on, again, what the need is. If someone's been out drinking all night, they can come in and they can get an IV. So there's just
Feel better.
there are a lot of things. In the hospital, people would come in and we would give them what's called a banana bag. So that was filled with nutrients. They had hangover or headaches. There's a lot of things that we can provide that IV for.
Okay, so some people come in like on a regular basis with an appointment, and some people just come in like, I need something right
Absolutely.
now. Okay.
Absolutely.
So you're kind of like, very flexible when it comes to the needs of people, clients, patients, or whatever coming in.
That is correct.
Okay. So this is something that I guess each individual person would have to think about and decide. Does this involve any kind of blood test, or do you do that before or after to see if this is beneficial?
Yeah, if you are, we can do labs, and based on those labs, we can determine what you need. So a lot of us are deficient in vitamin D. You can get an injection, you can get an IV with that. Vitamin C is just something that's going to help with immunity regardless to what you have going on. If you're sick, it's going to help you. If you're just feel like, oh, I need more vitamin C, I have no energy, we're going to give you that. We have one for memory, so we can give, if someone's having like a cognitive brain fog, there's something for that. So it's just going to depend on the individual.
On your needs. Okay.
Yes.
Is there anything else you want our viewers to know about IV vitamin therapy?
I personally will give myself, nurse practitioner will cannulate me, and I will give myself vitamin IV, and I think it is very helpful based on what my nutrition needs are in anyone. Based on what your needs are, it is a benefit there for having that IV.
Okay, it's good you're a walking documentation of this, that
Yes.
you go ahead and try it and do it too.
Absolutely.
Yeah. Well, I want to let you know that Nubian U is at 12211 South Harlem in Palos Heights, of course. And I'm sure that Michelle would be happy to answer questions if you wanted to go in or call. Am I correct
Yes,
with
absolutely. So you can contact us at 847-350-9575, or you can go to our website, which is www.nibnu.com, or you can, that's our website, you can email us at nubinu@gmail.com. So there's a variety of ways to get in contact with us, or just come into the office. We're there. We're there from 10 a.m. to 6 p.m. Monday through Friday, and we're also there Saturday and Sunday from 10 a.m. until 3 p.m.
Okay, so lots of hours. And there's always good to ask questions about anything that is new and different, because this is something at least new to me. I don't know if this has been around a long time.
It has.
It has. It's been around a long time. Look, I learned something new. And I'm sure Michelle is very knowledgeable, and she'd be happy to answer any questions that you have about this. Thanks for coming in, Michelle.
Thank you very much.
Yeah. And thanks for watching us on Living Well. Bye now.